Benefits of breastfeeding for mom. Breast milk is the most natural and perfect food for normal growth and healthy development of infants. Feeding will change as your baby grows. Newborns often want to feed every 2 to 3 hours. By 2 months, feeding every 3 to 4 hours is common, and by 6 months, most babies feed every 4 to 5 hours. Colostrum is rich in nutrients and anti-infective factors and should be fed to infants. Breastfeeding reduces risk of infections. It establishes mother-infant contact and promotes mother-child bonding. It prolongs birth interval by fertility control, delayed return of menstruation. Breastfeeding helps in retraction of the uterus. Incidence of breast cancer is lower in mothers who breastfeed their children. Now we see what are the benefits of nursing mother. Watch full video. 1. Release of good hormones. Many mothers feel fulfillment and joy from the physical and emotional communion they experience with their child while nursing. These feelings are augmented by the release of hormones, such as prolactin, produces a peaceful, nurturing sensation that allows you to relax and focus on your child. Oxytocin, promotes a strong sense of love and attachment between the two of you. Breastfeeding may help you lose weight. You may have heard this one often. While some women seem to gain weight during breastfeeding, others seem to effortlessly lose weight. Breastfeeding does burn more calories, and after 3 months of lactation, you'll likely experience an increase in fat burning compared to non-lactating mothers, though the difference isn't significant. 2. Breastfeeding helps the uterus contract. During pregnancy, your uterus grows immensely, expanding from the size of a pear to filling almost the entire space of your abdomen. After delivery, your uterus goes through a process called involution, which helps it return to its previous size. Oxytocin, a hormone that increases throughout pregnancy, helps drive this process. Your body secretes high amounts of oxytocin during labor to help deliver the baby and reduce bleeding. It can also help you bond with your new little one. Oxytocin also increases during breastfeeding. It encourages uterine contractions and reduces bleeding, helping the uterus return to its previous size. Studies have also shown that mothers who breastfeed generally have less blood loss after delivery and faster involution of the uterus. 3. Mothers who breastfeed have a lower risk for depression. Postpartum depression, PPD, is a type of depression that can develop shortly after childbirth. Women who breastfeed seem less likely to develop postpartum depression. If you have any symptoms of PPD, tell your doctor as soon as possible. 4. Breastfeeding reduces your disease risk. Breastfeeding seems to provide you with long-term protection against cancer and several diseases. The total time a woman spends breastfeeding is linked with a reduced risk for breast and ovarian cancer. Women who breastfeed have a lower risk for high blood pressure, arthritis, high blood fats, heart disease, type 2 diabetes. 5. Breastfeeding may prevent menstruation. Continued breastfeeding also pauses ovulation and menstruation. The suspension of menstrual cycles may actually be nature's way of ensuring there's some time between pregnancies. You may consider this change as an extra benefit. While you're enjoying precious time with your newborn, it's just one less thing to worry about.